As a new RN, and even through my first couple of years of nursing, reading a 12-lead EKG was really overwhelming. Hi friends, it's April and welcome back to the channel. There are 12 leads, dozens of patterns, and about 100 things that could be going wrong. But here's the good news. Once I was able to recognize one pattern, ST elevation, I realized that I was already steps ahead of many of my fellow nurses. Because ST elevation could mean something extremely serious. A STEMI, ST elevation myocardial infarction. Learning to read a 12-lead EKG was like learning a whole new language. But you don't need to know everything to be able to save a life. After recognizing this type of heart attack, it is critical that you ask if they've taken one medication before giving one of the most common initial medications to treat their symptoms, or you can kill your patient. I will go over that in this video. If you'd like a copy of the STEMI cheat sheet I will use in this video, there's a link in the description and the pinned comment below. Please like, share, and subscribe so I can keep bringing you this content. In this video, I'm going to simplify ST elevation recognition and show you exactly what to look for so you can identify a STEMI quickly and confidently, even if you're a brand new nurse, a nurse like me who was very uncomfortable reading EKGs, or just someone who needs a refresher. I'll also give you some simple memory tricks that'll make recognizing a STEMI so much easier. Let's start with the most important question. So what exactly is a STEMI anyway? If you've ever heard this term or just have an idea of what this type of heart attack is, you're at a good starting point. It is a very specific kind of heart attack and it stands for ST elevation myocardial infarction. So a myocardial infarction means that the heart muscle is dying because it isn't receiving oxygen. And the reason this happens is usually because a coronary artery becomes deprived of oxygenated blood. Every minute that heart muscle is starved of blood flow, cells are dying. Myocardium that has died cannot be regenerated. So we have to get the vessel back open as soon as absolutely possible. And that's why STEMIs are true medical emergencies. In cardiology, we refer to this period of time as time is muscle. A direct comparison can be made also to stroke patients. In that patient population, it is referred to as time is brain. The brain does have a potential ability that the heart does not, though, and that is sometimes the brain can make new neural pathways to take over some functions that were previously taken care of by some cells that are no longer working. So how do we detect this quickly? That's where the 12-lead EKG becomes incredibly powerful. So let's simplify it a little bit. Let's start with the neighborhood trick. Think of the heart as having three main neighborhoods. We'll start with the inferior, move on to the anterior, which is the front, lateral being the side. Each group of EKG leads corresponds to one of these areas. So the inferior leads, that corresponds in 90% of the population to the right coronary artery, and in 10% of the patient population, it is the left circumflex artery, because the very distal part of the artery that feeds the furthest out apex of the heart on the underside is generally taken care of by the RCA, but in 10% of the population that comes off the left circumflex. The EKG leads that correspond to this are 2, 3, and AVF. Your memory trick is 2, 3, and AVF, sit on the floor. Floor equals the bottom of the heart. These patients frequently are more likely to have lower heart rates, low blood pressures, and as the right coronary artery supplies the primary nutrients for the electrical components of your heart. And vomiting, in my experience, is seen frequently in this group of patients. Now, you can have that in any patient that's having a STEMI. That's just my own personal experience over the years. Anterior leads, your left anterior descending or LAD, or you're going to see in V1, V2, V3, and V4. Those are going across your chest. Your memory trick, V1 through V4, are the front door, front of the heart. Patients with this type of heart attack sometimes refer to it as having a widowmaker heart attack because the LAD supplies the largest amount of myocardium of the heart, and in patients who don't get that vessel opened up immediately, we do see a lot of deaths. And so that is why that is. Your lateral leads are your circumflex artery, and that is lead 1, AVL, V5, and V6. Your memory trick is lateral leads look left. And also circumflex, it flexes around the left side of the heart. So when you see STEMI in 2 or more leads in the same area, you should possibly be thinking STEMI. It is important for full diagnostic criteria. You do need the 3 leads in that one neighborhood to all have elevation. If you find this video interesting and you'd like to see what would be done for these patients in the cath lab, please comment cath lab in the comments below. I'd love to do a video on that if there's interest. It's where I've spent the majority of my nursing career, and it has always been very exciting and rewarding. So let's move on to what it actually looks like when we've got the EKG in front of us. This is where new nurses often overthink things. The ST elevation, or the ST segment, normally sits flat on the baseline. But in a STEMI, the ST segment rises above the baseline. Think of it like a small hill or dome shape on the EKG. And here's your memory trick, the tombstone sign. Many STEMIs produce a slight elevation that looks like a rounded tombstone shape. 3 contiguous leads, or the 3 in the neighborhood, inferior, anterior, or lateral leads, you should be thinking STEMI and activating your resource team. Some hospitals have a resource of an ICU nurse or a rapid response team. Sometimes they call whoever the patient's doctor is that's on call. Be sure to follow your hospital process. If the patient has had a previous EKG, you'll also want to be sure you have that handy, as whoever responds is going to want to be able to see that as well to see if there's any changes. Even though you might see something that's concerning, if they've already been diagnosed with a STEMI, this hospitalization, these might actually be smaller than what the patient had, so it might not be as much to respond to in this setting. That's why we always look for changes. Let's now go through a quick clinical scenario. You've got a patient walking into you in the emergency department complaining of crushing chest pain, sweating, nausea and vomiting, shortness of breath. They've got some left arm pain, jaw pain, and bradycardia. It's also critical for us to remember as nurses that while a lot of this is kind of classical signs that we're told to look for, women and diabetics also can frequently present with epigastric pain that's unrelieved by Tums, or mid-back pain as well. 12-lead EKG is performed, and you notice something interesting. Leads 2, 3, and AVF show ST elevation. So let's go back to our memory trick. 2, 3, and AVF sit on the floor. That means our inferior wall of the heart might be affected. Now your suspicion for STEMI is increased. We're thinking inferior STEMI. This often means the blockage is occurring in our right coronary artery. As 90% of the population, 10% maybe left circumflex. This is exactly why recognizing the ST elevation matters, because once the STEMI is identified, the care team can activate the STEMI alert. What that does then, it gets the interventional cardiologist on their way in, it gets someone like me and the rest of the cath team coming in. That way we can get the patient to the cath lab, we can get that artery unblocked, opened up with a stent, take out the clot. If there's a clot in there, it's very common. And this can literally save the patient's life. Now, let's take a second. Remember I mentioned that you needed to ask about one medication before giving a standard symptom relieving drug to a patient that's experiencing a STEMI because it could kill them? It's a class actually called phosphodiesterase inhibitors, Viagra, Levitra, or Cialis. I've actually worked with a few nurses who've cared for patients in their practice that have taken these drugs immediately prior to their STEMI and then were administered nitroglycerin and unfortunately were unable to be resuscitated due to the profound hypotension known to be a risk when these drugs are combined during an acute MI. They related extreme heartbreak due to this outcome. It is important to remember that given that these medications are taken for erectile dysfunction, patients are not always forthcoming regarding the usage. So I've found that a compassionate way to ask, and feel free to utilize this if it works for you, I get down and I whisper in their ear, in the past 24 to 48 hours, have you taken Viagra, Levitra, or Cialis? They will either say yes or no. And either way, I say, do you know why I ask? And they frequently say no. And I say, because having taken those drugs with nitroglycerin that we would be giving you during this procedure could drop your blood pressure dangerously low. And that seems strong, but it's critical for me to let them know that I'm not trying to pry, that I'm trying to be sure that the care we're going to give them is safe. And so I've had a few times where people said, no, I didn't. And then once they heard the reason I'm asking, they said, yes, I did. And then we didn't give the nitroglycerin and things were fine. So quick, when you're on the floor, you don't have time to analyze every detail. So here's a simple 4-way system to screen for STEMI quickly. Look for ST elevation. Check if it appears in those 3 contiguous leads, inferior, anterior, or lateral. Identify which heart area those leads represent. Combine EKG findings with patient symptoms. Very critical. Chest pain plus ST elevation, emergent evaluation. And here's another helpful memory trick. 3 leads, 2 millimeters, 2 minutes to act. 3 leads showing elevation, 2 millimeters of elevation, 2 minutes to escalate the concern. This keeps your response fast and focused. Common mistakes that a lot of new nurses make. Let's talk about the things that actually can delay immediate action. Sometimes they look at one lead without looking at the other neighboring leads, ignoring symptoms. EKG matters just as much and even more when they are accompanied by chest pain, shortness of breath, diaphoresis, nausea, left arm pain, jaw pain. Mistake 3, I think, is probably the most common. Second guessing yourself. If you see something concerning, escalate the concern to a charge nurse, other experienced nurse, or MD. Don't worry, no one's going to judge you. We've all been there. You don't have to diagnose the STEMI by yourself. But recognizing something abnormal and notifying the provider can make a massive difference. Reading EKGs takes practice. I encourage every new nurse to treat EKGs like I did and actually still do. Anytime someone says, hey, check out this rhythm, I do. Because even though I've done this for years, I don't see every odd rhythm frequently. You really don't need to memorize every rhythm or waveform to recognize a life-threatening emergency. If you remember these key ideas, ST elevation signals possible heart injury and possible impending death, look for elevation in 2 neighboring leads, use lead groups to identify the heart region, you'll already be far more confident interpreting EKGs. And most important, you'll be able to recognize a STEMI quickly enough to help save a life. Because when it comes to heart attacks, remember this phrase, time is muscle. And if you enjoy this video, why don't you hang out for a while and check out this one on cruise nursing?